why would individuals that are receiving a lot of blood transfusions have hypocalcemia? Well, let me tell you why. So proper nutrition plays an important role in recovering from an illness, disease prevention, and overall maintaining a good health. Since nurses spend the most time with patients in the hospital and they are the main contact, it is important for nurses to have a general understanding of food and nutrition. But topics related to medical nutrition therapy and the complexities of diseases should definitely be reserved to a dietitian. I speak from experience, and honestly, it can cause more harm than good. So in today's video, we are going to be speaking about what nurses need to know about nutrition. So I personally think the first and most important thing that nurses need to know about nutrition is that there is a dietitian available. Nurses, you do not have to take it upon yourselves to speak with your patients or clients about the intricacies of nutrition. Nutrition is a very hard and interlaced topic. So just know that dietitians are there in your corner. We're not here to compete with you. So seeing that that's all cleared up, now let's get into some macronutrients as well as micronutrients. So let's begin with carbs. And everything that I'm going to say here is actually from my experience working with nurses. It's not meant to degrade the profession by any means, but it's some things that I want to clarify. So carbs are not the enemy for your patients that have diabetes. The body actually prefers carbohydrates as a source of fuel, as a source of glucose for energy. So for a patient that has diabetes or gestational diabetes, excluding carbs from the diet can actually be detrimental. Someone may think that carbs are being excluded to help bring down high blood sugars, but it can actually do the opposite. It can actually result in hyperglycemia. So foods that contain carbohydrates are breads, cereals, rice, pasta, potato chips, fruits, milk, yogurt, and of course your cookies, cakes, pies, desserts, and different types of sweets. Those foods do contain carbohydrates as well. So these foods are not bad. There's no such thing as a bad food. I personally do not like the labeling good food, bad food. So for a person that has diabetes, the problem is how much of these foods are they consuming. So what the patient actually needs to be on is some type of consistency. Consistency related to meal timing, carbohydrate spacing, and actually how much carbohydrates are they consuming at a particular meal. So if these things are not a nurse's expertise, then that's a-okay. Please refer your patient to a certified diabetes educator or a registered dietitian, because it's not only about the insulin or the oral hypoglycemic agents. Diet and lifestyle play an integral part in bringing down hypoglycemia. The second thing that nurses need to be aware of is iron. There are a lot of patients, from my experience, especially in the older population, that do come into the hospital with iron deficiency anemia. And actually, iron deficiency anemia is actually the most popular type of anemia. So it is important to know that there are heme and non-heme sources of iron. So heme sources of iron come from animal products such as poultry, beef, and fish, for instance, and the non-heme sources of iron come from plant products. So the heme sources of iron are absorbed more rapidly and readily versus the non-heme sources. So non-heme sources of iron may include broccoli, you have beans, bran, and dark leafy green vegetables, for instance. Additionally, acid aids in the absorption of iron. So foods with a high vitamin C content, and that can include orange juice, which is very popular, but also know that tomatoes and bell peppers have good sources of vitamin C in them as well. It is also important for patients to know that there are certain foods that can block the absorption of iron, and these foods are foods that are high in oxalic acid, which contain your teas and your chocolate, and also foods that are high in calcium, such as dairy products. So speaking about calcium, 99% of calcium is contained within the teeth as well as in the bones. And 1% of calcium is actually in your blood serum. And that 1% is definitely critical for life. So if your body senses that your serum calcium is going down, it's actually going to leach it from the bones and also the teeth. And what happens? The bones get weak. So foods that have calcium in them are your dairy products, as well as there are greens that have calcium rich sources in them as well. So calcium absorption is controlled by vitamin D as well as some other hormonal mechanisms within the body. So in order to have an adequate amount of calcium, we need to make sure that that vitamin D level is within normal limits. Additionally, as nurses, you need to be familiar with certain medications that can cause hypocalcemia or low calcium levels. Some of these medications include furosemide, you have phenobarbital, and also dilantin. Long-term use of phenobarbital and dilantin can cause hypocalcemia. Hypocalcemia is also very common in individuals that have sepsis, rhabdomyolysis, and also individuals that are receiving large amounts of blood transfusion. Now, I wanted to talk about the blood transfusion for a little bit. Why would this be? Why would individuals that are receiving a lot of blood transfusions have hypocalcemia? Well, let me tell you why. So that blood is preserved with citrate, and citrate actually binds ionized calcium when transfused in the body, which renders the overall calcium levels low. So when you are given blood transfusions, even if it's not massive amounts of blood, definitely monitor the calcium levels. The next thing that we're going to speak about is protein. So protein is a very extensive topic. Loss of a significant amount of protein in the body can lead to debility and death. It increases morbidity as well as mortality. And also protein is something in my personal practice that I always focus on when I'm dealing with individuals in critical care. So the recommended daily allowance of protein for a healthy individual is 0.8 grams per kilogram per day. So hypothetically speaking, if you had a client that weighed 50 kilograms, they would need 40 grams of protein per day in their diet. For a patient that may be malnourished or at a nutrition risk, the protein recommendation can actually go up to 1.5 grams per kilogram per day. For patients that are suffering from trauma or even burns, that protein intake, or the protein recommendation rather, can go up even further. It can go up to 2.5 grams per kilogram per day. And the reason why the protein tends to go up is because in the ebb and flow phase of catabolism and anabolism, the body actually needs greater exogenous sources of protein in order to repair itself. And if it doesn't have that, it's going to take the protein stores in the body from the muscle, which can lead to cachexia and sarcopenia, which is not good. So there are some conditions where extra protein may not necessarily be recommended. So individuals that may have renal disease. So if your patient has this metabolic condition and they're also a patient that does have any type of traumas or burns, this is definitely where a dietitian needs to be on the case. And then also the different vitamins. So there are fat soluble vitamins as well as water soluble vitamins. So I actually made a video about fat soluble and water soluble vitamins and also the foods where they are found and different medication interactions last week. So that video is popping up now. So I do want you to go ahead and take a look at that. So guys, this is in a nutshell what nurses need to know about nutrition. If you have any questions, whether they are general or they are a little more in-depth, please feel free to leave them in my comment section below. Thank you for watching. Remember to like, subscribe, and share this video. Have a good day.